Hello and welcome. Today we're going to be talking about a very important topic, which is mast cell activation and multiple sclerosis. And I'm going to explain to you, number one, what mast cells are, what their role is in or job is in our body, but also I'm going to explain to you how they're involved with multiple sclerosis and how that involvement adds a lot more proof and evidence that multiple sclerosis is an infectious disease. And if we haven't met, my name is Pam Bartha, and I am the author of Become a Wellness Champion and the founder of Live Disease Free. I was diagnosed with multiple sclerosis over 30 years ago, back in 1988. And this topic really helped me back then. So we're not going to just talk about these mast cells. It's not just going to be a biology presentation, but it's also going to be talking about things that are helpful for MS and really how this information is helping us to focus on treating the cause. Because if we know what the cause of multiple sclerosis is, and we're able to treat the cause, this is truly the only way to recover from MS. So I'm going to start with just sharing with you a little bit about the history of mast cells and multiple sclerosis. We'll talk about what they are later, but basically already in 1890, it was discovered that the mast cells were located in the lesions of MS patients. So in MS patients' brains, in the MS lesions, they found these mast cells. And so these immune cells, so we're going to talk about what they are exactly, but they're immune cells. And they're also involved in other diseases, so not just multiple sclerosis, but if you have MS, you probably have other conditions also. And so we know that mast cells are really involved in things like allergies and asthma, anaphylactic reactions where we have really severe reactions to things like seafood or maybe peanuts, etc. They're also, mast cells are really upregulated, or there's more of them in things like gastrointestinal disorders. So they're activated when people have inflammatory bowel disease, etc. And also they're activated in different types of cancers and heart disease. So it's not just MS, not just rheumatoid arthritis, which I mentioned earlier, but in virtually, I believe, all different types of diseases. So mast cells are activated in all these conditions. And they are involved in MS in different ways. So we're going to talk about their job. But when I talk to you about the mast cells, I want you to understand they're not a bad thing. They're a really important part of our natural defense against parasites. And everything they do is incredibly complex and incredibly intelligent. So mast cells are involved with, number one, they release immune molecules. So this is starting the inflammation process. So they'll release cytokines and chemokines. They will also release histamine. And so this is, all these different things are really getting our different parts of our immune system going, like to get them involved also, because on their own, it's not enough. And there's different parts of our immune system, T cells, B cells, et cetera. They all have different roles. Some like with the mast cells, that's part of our innate immune system, our innate immune response. They're the first immune cells to the scene. So they're patrolling basically our airways. They're patrolling our intestinal lining. They're patrolling our skin. And they're the first ones that set off the alarm. Hey, there's a parasite trying to move in. We have to deal with it. And so what they're releasing, these different immune molecules, and you may have heard of a cytokine storm, it's really engaging different parts of our immune system. So that will activate our T cells and our macrophages. And I always like to think of macrophages like a Pac-Man. And then they present antigens. So that's like a piece of the enemy to the T cells, and that activates them. They also will disrupt the blood-brain barrier. The mast cells will disrupt the blood-brain barrier, which is important because we need to have more of the immune system in there if we have an infection. So all of these things is what's kept humans alive for many, many, many years. And so what are they and where are they located? What's their jobs? Mast cells are white blood cells. And again, they act as our natural defense against different types of parasites. So that would not just be worms, but it would also include different types of bacteria and fungi. And we've talked about protists, which are single cell parasites. We'll talk more about those later, but also worms. And they're kind of like the patrol over our GI tract and our airways and our skin. So wherever these parasites can try to make their way into the body, the mast cells are the first line of attack. They're our first soldiers. And they originate in the bone marrow, and then they live in body tissues that are exposed to the external environment. Again, our gastrointestinal tract, the lining, because like if we swallow something, we could swallow parasites, whether it's eggs, larvae, etc. And then it is if it's not destroyed by our stomach acid and it goes into our intestines, the mast cells are there to sound the alarm and to start the process of dealing with the parasites. So they originate in the bone marrow, then they move out as they mature. They move out to tissues, and they really maintain health in those areas. Then when parasites are introduced or become present, then the mast cells can rapidly release these immune molecules like the cytokines, the chemokines, even enzymes, which help to destroy parasites. And then the chemokines and cytokines, they will cause other immune cells to become engaged. So it's going to be it's like they're the beginning of an orchestra where they're just getting this whole process of protecting us from various types of infection, because we want the immediate help, right? But then we also want our immune system to remember parasites, that it's beaten. And so there's the innate and the adaptive. So the innate is kind of like the first responders, the first defense against parasites. And then we have the adaptive immune response, which is kind of more recruiting, the B cells, the T cells. And then some of those cells are going to remember in the future. So the whole process will happen even faster to deal with parasites. So mast cells are found in high concentrations during parasitic infection. So what I'm sharing with you is science. This is what's known. So again, mast cells are found in high concentrations. They're activated during various parasitic infections, including worm infections. They play a really important role in both the innate and the adaptive immune response to the parasites. And go ahead and type your questions. If I have enough time, I'll answer your questions at the end. So mast cells were essential so like in science, they found that when people had this infection of strongyloides, which is a very small nematode, that the mast cells were really, they just basically said, in the study, they said essential for the termination of these intestinal nematodes. And so again, it's not just getting other immune cells going, but they directly can be involved in destroying the parasites themselves. And I read somewhere one of them was some of the enzymes that they produce will help to destroy the parasites too. And of course, it depends on how many parasites we have, how big they are, etc. But they're super important. So the responses of the activated mast cells in the early stages of worm infections are really important. But sadly, parasitic roundworms, they can produce a protein that inhibits the whole inflammatory immune response. So I've talked about this in my masterclass training, which I'll be doing next week, about how a lot of different microbes have many ways. They found at least 17 different ways that parasites can cause immune dysfunction. So basically, if the mast cells do not become activated, they're not releasing those chemokines and cytokines that activate the entire immune system to warn the immune system that we're dealing with parasites. So if the parasites will produce these proteins that will basically decrease or make our immune response not effective, that is beneficial for the parasites, but it's really harmful for us. And mast cell activation can also be caused not just by worms, but by different types of parasites. So there's different protists, the single cell parasites. Some of you may have been tested for protists, and you may have tested positive for Blastocystis hominis or dientamoeba. Those are two different single cell parasites, and so they can also cause mast cell activation. And then also disease-causing bacteria. So the bacteria that causes Helicobacter and just a couple of different ones, but I'm sure there's many others. So what's really frustrating is that there's not a lot of research in this area. So what I'm sharing with you is research, but you would think that when you go through all of this, it makes so much sense that we're dealing with parasites because our immune cells are activated. Our immune cells that go after parasites are activated. It's like common sense, logic. Why are we not researching this? And then mast cell activation symptoms, maybe you have had some of these. So this is not totally conclusive. There are many, many symptoms of when we have a lot of mast cells that are activated, again, because we're dealing with different types of parasites. So the resulting symptoms can range widely and not necessarily connected to gut infection. So that's why it's also hard for us to know. So mast cell activation symptoms can include, so with respect to the skin, we might have itching, flushing, hives, swelling, sweating, or a rash. That was our skin. And our eyes, we might have irritation, itching, and watering. For our nose, we may have itching, runny nose. For our throat and mouth, we might have itching, swelling of the tongue or lips, swelling of the throat. And for the lungs, we may have trouble breathing, we might be wheezing, so think about asthma. And then for the heart and the blood vessels, oh good, I just want to make sure you guys can hear me. So with respect to our heart and blood vessels, low blood pressure, rapid heart rate, stomach and intestinal symptoms would include cramping and nausea and vomiting and diarrhea, abdominal pain, and the nervous system would be headache, confusion, fatigue, anemia or bleeding disorders, bone and muscle pain, enlarged liver, spleen, or lymph nodes. So maybe you can relate to some of those: depression, mood changes, or problems concentrating. And then, of course, with increased mast cell activation, we can have anaphylactic reactions, and that's where we can see it's very dangerous. And if you're allergic to something, if you have an anaphylactic reaction to certain things like peanuts, for example, you have to avoid it. It could literally kill you. So this is where we would have a rapid drop in blood pressure, can have feeling of lightheadedness, weak pulse, trouble breathing is a really big one where your throat closes, and or quick and shallow breathing, confusion, or loss of consciousness. So there are many, many symptoms of mast cell activation. And then I just wanted to finish off with a really important point. And when I was first diagnosed in 1988 with multiple sclerosis, I have a friend in my hometown who's Dutch, from Holland, from the Netherlands, and that is my mom and dad's background too. And he was, because he was a physiotherapist, he was very interested in MS and a family friend, etc. So he did some research and he found this neurologist in the Netherlands called Dr. Mast. And so there was actually two Dr. Masses. There was a mother and a daughter, and they were neurologists, and they both had multiple sclerosis. And they were managing, so this was back in the 1980s when I discovered them. So for a few years, they had been managing multiple sclerosis in their patients by number one, changing their diet. They were really only focused on trying to eliminate foods that their patients could be sensitive to. So removing foods that their patients were sensitive to, and then giving them an antihistamine. And they recommended polyramine at the time. So again, mast cells release histamine. And so at the time when I was just diagnosed with multiple sclerosis, I had terrible insomnia. I could not sleep. I felt like my body was vibrating. And so taking what they said, taking their advice, I started to take polyramine, which is an antihistamine, and that really helped me tremendously. So that helped me so that I could sleep, that I felt peaceful, that when you can sleep, then you can start to work on healing. If you can't sleep, you just become more and more sleep deprived and everything gets worse. So that was my first introduction to antihistamines. So then later I discovered through the work that we do with our Live Disease-Free program and the wellness champions that we've been helping, and I'll talk more about that later, but I came across the work of, well, it started with one doctor and then finding several doctors that found that they believe that MS is an allergy disease, that the cause of MS is an allergy or allergies. It could be more, it might, that you're not allergic to one thing, but multiple things. And one doctor that I found particularly interesting, Dr. Jonas from Tacoma, Washington. So he actually was a medical doctor, might still be, I don't know if he's still alive or not, but he was a medical doctor. He went to a workshop or a convention at like a medical conference, I would say, and he heard this one doctor talking about how he felt that MS was caused by allergies. And so again, unfortunately, we're not talking about the parasites that are causing the allergy, that causing the mast cell, but we're just kind of going back and connecting dots right now. So this Dr. Jonas, he went to this medical convention, he heard about the possibility of MS being caused by allergies, and then he heard from that other doctor that doctor felt that giving histamine to MS patients was really helpful. And that doctor shared his experiences, how it was really helping his patients. So Dr. Jonas thought, wow, I've got this MS patient that I cannot help. Nothing is working for her. Again, this was back in the 1950s, 40s. And so there's nothing I can do for her, but maybe this will help her. So he went back to his hometown and he met with his patient that had MS and gave her histamine. So, and it would have been, I believe, an IV histamine treatment. So this is something that has to be done by doctors. And she just improved so much, and that got him so excited that he started to help other people. And you can imagine back in the day that all of a sudden, if one person is completely symptom-free or almost symptom-free, then the next person is going to be like, what happened to you? Where did you get? So anyhow, he got more and more patients that wanted to use histamine injections. And then he ended up in this hospital, St. Joseph's Hospital in Tacoma, Washington. And the nun there gave him a whole wing of the hospital because he was getting so many patients. And so that wing became totally full. And then they ran out of room again because people were coming from all over the place wanting to be treated for, and it wasn't a cure for everyone, but it was significant for a lot of people. And so then it ended up where people would stay at hotels, and literally like the people in the hotel, the admin, they say, you know, one person would come in on a stretcher, so disabled with multiple sclerosis, and maybe 2 or 3 weeks later walking out and being totally like what? So he wrote a book, and his book is not in print anymore, but I just wanted to share with you the book. I paid $200 for this book because I found one print. Okay, here we go. I have to do everything backwards. So I found one of these books, and I think I saw one online now that's for $350 US. So I literally had to drive from Canada to the US border and pay $200 for this book, but because I wanted to know what his experience was. I wanted to know, firsthand from him. This was the doctor that was giving IV injections of histamine to MS patients. And so I'll talk about Dr. Jonas in a minute, but I just wanted to give you kind of a little bit of a history. So I believe it's a Dr. Meyer, but Meyer in 1947 really believed that MS was caused by allergies. So that this was the first person. And whether researcher or doctor, I would assume this would have been a doctor, and giving successful treatments to 13 cases of multiple sclerosis. And Meyer wrote, multiple sclerosis is a long and unpredictable illness. The patients have had a remission for better than 15 months of the 13 cases, but conclusions cannot be drawn from that at this time. So this was back in 1947. And I should let you know that I have a blog on livediseasefree.com. So I will be putting the notes in our blog that will be released this week. So you'll be able to read this information. You'll be able to look at the video again. If you like, you can actually find these doctors, and please share this with others. Please help us to get the truth out. And then we have Dr. Horton, and Dr. Horton is the next doctor that I wanted to share, and he's the one that Dr. Jonas heard speaking of his experiences. So Dr. Horton, he was of the Mayo Clinic, and he shared, there is good reason to believe that multiple sclerosis is an allergic condition. And while most doctors were prescribing antihistamines, Dr. Horton did exactly the opposite. He administered histamine and had great results for both allergic conditions and many other illnesses. So this is not just for multiple sclerosis. And horrible headaches disappeared, as did the symptoms of Meniere's disease, also ear and eye conditions that were previously thought to be incurable. They responded to histamine treatment. And Horton's method was, in a sense, to fight fire with fire. By giving histamine, he lessened the power of the body's producing histamine that was causing the problem. So instead of suppressing the action of histamine with his antihistamines, he used histamine against histamine. The next doctor is Foster Kennedy, MD, and Dr. Foster was professor of neurology at Cornell University, and they asked him, do you believe that multiple sclerosis may be explained on a basis of allergy? He replied, this is a matter of which I have given a great deal of thought to for many, many years, and I finally reached the conclusion that multiple sclerosis cannot be explained on any other basis than allergy. And then we come to Dr. Jonas, and again, his book is here we go, oops. Let me just do it this way. It's all backwards from what you see on here. So, My Fight to Conquer Multiple Sclerosis by Dr. Hinton D. Jonas. And Dr. Jonas, as I mentioned, this was all done in Tacoma, Washington at the St. Joseph Hospital. He had a whole wing that was dedicated to this therapy. And Dr. Jonas treated over 2,500 patients with histamine therapy, most of which of these patients suffered with multiple sclerosis. His patients also avoided foods and environmental factors that the patient was sensitive to, and they used histamine IV treatments. So in his book, My Fight to Conquer Multiple Sclerosis, Dr. Jonas stated, MS symptoms were definitely arrested in 1 person out of every 6 treated, and everyone who stuck with the treatment consistently for 90 days showed improvements. We could relieve symptoms even where we could not arrest them. Many were leaving their beds for the first time in years. one man unable to move as much as a toe for 7 years, 1 week after he arrived, walks 1 week after he arrived at the clinic. Histamine therapy can make the blind see, the deaf hear, and the lame walk. So Dr. Jonas stressed that it's not a cure, but it would be similar to giving a diabetic insulin. And he didn't want to take credit for the treatment, and he's a very humble man. But unfortunately, this treatment became so popular and created such a stir that it was completely shut down, which is so brutal. Again, St. Joseph Hospital in Tacoma. And then we have Dr. Felix, and I'm just going to leave it at Felix because his last name is fairly long, and I have his book again. Also, he's a Canadian doctor. There we go. So if you guys want to see it, there. All right, so his book, The Plot Against Asthma and Allergy Patients, it was still available on Amazon, and I highly recommend his book. It may not be now, I don't know, that was a few years ago. But this doctor, Dr. Felix, he observed that histamine therapy stimulates the body's ability to heal itself and freed hundreds of asthma, allergy, and migraine sufferers from being dependent on maintenance pharmaceuticals with their detrimental adverse effects. His book explains the biochemistry and the genetics involved in allergies, asthma, and related disorders, and shows how to repair these defects. And this Dr. Felix, he treated over 3,000 patients with histamine therapy before he lost his license, and was a Canadian doctor. And many of his patients attended that had recovered from asthma and other conditions. They attended his hearings in defense of him, in defense of the important work that he did. And when I did the research on him, years and years later, there were still people like, hey, he was my doctor years ago. He helped me so much. Is there any way I can does anybody know how to find him or access him? And unfortunately, he lost his license. He was not willing to cave. He was not willing to not give that treatment. So he is a real hero. And so, like in conclusion, what I wanted to share is just so disheartening that when you have these potentially really helpful, safe therapies that can make a difference, and maybe they weren't perfectly on track. So again, mast cells produce histamine, right? And so we can have this overabundance of histamine from these parasitic infections because mast cells are our immune system's response to parasitic infections that get into our skin, get into the digestive tract, or into the lining of the airways. And so the doctors knew this histamine connection, but they didn't know to go backtrack and go, well, maybe we could have even more success if there are parasites and we treated them so the mast cells don't have to produce all that histamine, right? Or maybe they could have used the IV histamine treatments to help their patients feel better, way better than a lot of other disease maintenance drugs, etc., and then treat the parasites as they were doing that. I believe that's awesome. But unfortunately, we'll never know because just like other remedies that have been so effective against cancer, etc., this is a perfect example of the corruption in our healthcare system, which is really sad. So again, mast cells are immune cells that defend us from parasitic infections in our digestive tract, in our airways, on our skin, anywhere these parasites could potentially break into our body. All right, so that's what mast cells do. And they also, they directly help to treat the parasites, but more so they're involved in getting other parts of the immune system involved also. And so they're incredibly important. And if they are being activated abundantly, we shouldn't be just going, oh, immune system has gone haywire. We should be saying, okay, which parasites could we be dealing with? And what our healthcare system instead they will say, well, let's come up with these big fancy words or terms for mast cell activation disorder, mast cell activation disease, mast cell activation syndrome. And all of it is saying that our mast cells, they are not functioning properly. They've maybe mutated, they're excessive, but it's like, what's their job? Parasites? Oh, I wonder if we have parasites. But the reality is there is no money in treating parasites, unfortunately. It's much more lucrative to give people immunosuppressive drugs for the rest of their lives. A lot of the MS drugs, they're over $100,000 per year now, the newer ones. And that's much more lucrative than a very old parasite drug or a couple, three that are no longer patented. And it might cost hundreds of dollars to help people recover, not millions. So the evidence I've shared with you I hope that it really helps you to see another layer of huge amount of evidence and proof that MS is an infectious disease caused by a parasitic infestation. So I'm going to go to your questions, and I just wanted to share with you too that, do we have to wait? It's so like, I don't want to leave you feeling like, okay, so Pam, so now we know more that it's probably parasites, but what can I do? Like, I don't want to live like this anymore. You don't have to. We have solutions right now. So we have the Live Disease-Free plan where we've served hundreds and hundreds of people all over the world. I don't know that I have the successes, but I have had some amazing, I'll do that next week. No, next week I'll be doing my masterclass, but I will be sharing the more current successes. So we're like one couple in India, the husband has MS, and he's just done his first, I believe, a first treatment cycle. His balance is better. His spasms are way less. He's able to go out in the garden. He's happy. He's able to dry himself off. He was becoming so disabled so quickly. And when you treat these parasites, that is really getting to the root cause, and that's even better than histamine injections. If we could ever find doctors that would maybe research this, and maybe it might be helpful for some people in conjunction, but really we don't have to wait. We can treat, and we do that through the Live Disease-Free plan. So if you're new to all of this is the first time you've met me, make sure to watch our videos on YouTube, Live Disease-Free. Also, we're moving on to Rumble, Live Disease-Free on Rumble, on Facebook also, and start to learn about these parasites, start to learn about the diet, start to change your diet, and start to feel better. The diet can be dramatic as far as symptom improvements, because when you stop feeding these parasites so much, then we notice inflammation goes down, and we notice people have a lot of symptom improvement. So that's really important, is the diet, and I've got lots of information on our website, livediseasefree.com, and on our videos, etc. So start changing your diet, start learning about the parasites, but when you're ready for a plan, make sure to reach out and don't wait. You don't have to live like this. It is brutal, it's awful how sick these parasites can make you feel. I know I have passed a lot of parasites, and I can tell you, the more you pass, you just feel more normal. You just feel like, oh my gosh, I can eat these foods and they don't bother me. Healthy foods. I stick with healthy foods. Oh my gosh, like I have energy and I feel younger. I feel like 20 years younger. The parasites they add this strain onto your body through the poisons they produce, through the other microbes they're infecting us with, etc. Our immune system is constantly fighting the mast cells, the other immune cells. And if you treat them, then your immune system can kind of take a breath and just relax a little bit, and you feel so much better. So watch my masterclass training if you're at the place where you would like support. If you don't have a doctor that will help you treating parasites, we have a plan. We help people all over the world, including India. And so we can help you, and we would love to help you. We would love for you to be the next success. So I'm going to go to a few questions. All right. Hello, Maureen. Hi, Joanne. Hi, Margaret. Judy, thank you so much for your kind words. You finally remembered to join again. Awesome. So happy that you're here, Judy. And Joanne, I'm doing really well. I had a little bit of a flu bug, I have 5 grandkids, and I have 1 more on the way, and they're all under the age of 10, and they are starting to pass germs around, and I can't help but smooch them. So I don't know if I had like a version of COVID or a different, I don't know what it was, but it got me. So hopefully I won't be exposed to too much. Someone who keeps getting mycoplasma infections, might this be related to worms and parasites? Absolutely. You may find that you are not successful in clearing the mycoplasma if you don't treat the bigger worms. Absolutely. What I've noticed is that the bigger parasites infect us with the smaller parasites. Can MS be misdiagnosed, Pam? Well, to me, what multiple sclerosis is a parasitic infestation, and that is not a misdiagnosis. But you could have neurological symptoms that are the same with Lyme disease, with MS, and other diseases. Like there's a lot of overlap between PLS, for example. Actually, before I forget, I wanted to mention that this histamine injection were helping people with ALS also. Again, ALS is a parasitic infestation, but we have slightly different parasites. So could MS be misdiagnosed? I really believe MS, if you get that diagnosis, you have a parasitic infestation, and that's not a misdiagnosis. And if you treat the parasites, you'll get your life back. Hi, Judy from Utah. You thought you weighed good until you went onto my recommendations. And so there are a lot of healthy foods that we do avoid until we successfully clear the parasitic infestation. So it's not that fruit and nuts and things like that are bad. It's just that these parasites thrive on carbohydrates. And if you continue to eat the carbs, you will feed them. Once you treat them really well, then you can have more fruit. Treat well enough that you are symptom-free for a few months. Then you can test and you can find that you'll be able to tolerate the carbs again. But I personally wouldn't go back to things like beer and pizza. It's just not worth it when you have recovered from chronic diseases like multiple sclerosis. Hi, Ronnie. So nice to see you. Hi, Louise. Are the different MS types, relapsing, remitting, secondary, and primary, directly related to the level of activity of the mast cells? I don't know. I know that they are related to the level of parasitic infestation that we have. And sometimes it's that we're really infested, but it's the environment. So if we have a lot of parasites, there are some people that really take care of themselves. So they'll eat healthy, they'll get sleep, they'll be exercising, and maybe they'll get breaks in between. They'll get an attack, but the body can deal with it and kind of recover somewhat. And then there's other people maybe that don't realize it, but they're really feeding the infections or eating a high carbohydrate diet. Maybe they're not going to bed on time. They're not getting enough sleep. They have insomnia. Some things are our fault and some things aren't. The stress level, our sleep, all of these different things, which parasites we have. So I think it has more to do with that than it has to do with, because over 80% of people that have relapsing remitting, it turns into progressive MS eventually anyhow. So it's probably the level of parasitic infestation that we have in our body. Margaret, very interesting. You do suffer from skin problems, which histamine would be useful. Again, high histamine levels or high inflammation, those are clues, they're symptoms of infection. So we can try to do symptom management by taking an antihistamine, and antihistamines do have adverse effects. So I personally would not live on an antihistamine. Obviously, when I first was diagnosed, it helped to bring me out of the danger zone, and I used them for a short period of time. I would not recommend living on antihistamines. You need to read up on the adverse effects. But it is what I've shared with you is more evidence that parasites are causing MS. And if you focus on parasites, on treating them, getting ready to treat, and then treating them as quickly as possible, you're not going to need antihistamines. Your histamine levels will be totally normal, right? So that is the key, is to Sometimes you might need to use histamine or an antihistamine short term. Maybe you're not sleeping, but you're on a plan to treat the cause. That's fine. But if you are going to use an antihistamine, check with your doctor, check with your pharmacist, because sometimes there can be negative interactions between medications you're taking and the antihistamine you want to take. So very important to check with your pharmacist and or your doctors. Don't just take a medicine. You could really hurt yourself. Don't take higher than the bottle dose. I wouldn't take it for long periods of time. But if it helps you, then you're going, aha, what Pam said is really working. And so now I want to carry this farther. I want to have wonderful recovery. And then you treat the cause. I don't know. So what I've noticed is that, Nicholas, if you are stuck in the parasympathetic way, so again, if we have a lot of stress from these infections, from life too, but especially from these infections, we can end up in like a stress mode all the time, and that can really impact us, our adrenals, etc. So it can impact our adrenals tremendously. We can end up with adrenal fatigue. So what I found the most helpful is, number one, change your diet so these infections are not as active, support the body in various ways, and then to start treating. And you might need to support things like adrenals, etc., with just some simple supplements. But I mean, you can use some type of, I don't know what that therapy is. I don't know if it's something you take orally, or if it's just like a physical physiotherapy type thing that they do. But again, if you're not treating the cause, what's causing the stress on your body, which would be, if you have chronic disease, it would be the parasites. And then obviously we want to deal with stresses in our life for sure too. How can we coach through the program and get advice on how to do the treatments without triggering a flare? You're 36 years old, you're in a wheelchair, and you have been since 2020. Oh, my heart goes out to you. I'm really sorry that you've suffered so much. You're so young. So what we do is we have a proven plan where you basically have access to a course, a members area for the Live Disease-Free plan. And so it's just starting step by step. So before we start treating, it's very important that you're feeling a lot better. So this is through the diet. So for example, another student that just shared, John, and we've shared his successes, but I can't remember, I think it was 12 reps of like, I don't know if it was like 100 pounds, 90 to 100 pounds that he can do now. He's been in a wheelchair for 22 years. And he was just exercising just a few days ago with his physiotherapist. And his physio guy said, you don't have these, they're not leg tremors, but it's clonus. It's basically a type of like a tremor in his leg. He said, you don't have any today at all. Like, what's up with that? Is it the cooler temperatures? He said, no, it's a Live Disease-Free program because he's treating the parasites. So he was so bad that before he started the program, he could not even cheers a glass of water to his friends and family. He would be having such terrible tremors. He couldn't cut his food. And if you haven't listened to his story so far, and he's just maybe on starting the second treatment cycle, it's just shocking the improvements that he's had even before he started treating. And so that is really the important thing. I don't know what your name is. It says unknown on Facebook. But the first thing is that you want to be feeling a lot better before you start treating. And then when you start treating, you're going to use treatments that you test well for. And then when you use them, you're just using them, you're introducing them one at a time slowly. We teach you how to do everything so that you use them safely and effectively. It's night and day when you use them, though. It's so incredibly helpful. So do we still have that treatment? I don't know what you mean by that. Sorry, Joanne. Amazing information as always. Thank you, Maureen. A couple more questions. How long did you do the diet to see results? You should, Jeanette, you should, or Janet, you should notice symptom improvements within 7 to 10 days if you're following the diet well enough, and that means your carbs are low enough. Very quick, especially bladder is one of the first ones. Hello, Margaret. So you said I'm in 36 of this lifestyle change, and you have not seen any changes yet. So that just means your carbs are still too high. And it doesn't take much to feed these parasites. It could be a little bit of sugar in your bacon. It could be a little bit too much fruit. It could be too much avocado, a little bit too many nuts. And that's why you want to really check your work and get your carbs down to about 35 to 40 total grams of carbs total, which includes sugar, fiber, carbohydrate, and possibly starch. Margaret, you want a list of providers to treat the parasites? I don't have a list that I can hand out, unfortunately. Mary, I don't, it's not that I'm withholding it from you. I don't have a list. There are very few doctors that will treat the parasites. Mary, will doctors prescribe histamine? No, they won't. Not that, well, I'm in Canada, and I know Canada is really tough as far as we have to follow standard of care here, or they will lose their license. And as far as I know, there is no such thing. And there was a nurse in the United States that she was getting histamine injections from somewhere, and that was shut down too. So that has all been shut down many years ago. Denise, did anyone go from not walking to walking again? Are you talking about in the Live Disease-Free plan? Yes. And also with the histamine injections? Yes, there were definitely. But Dr. Jonah said 1 out of every 6 was, I don't know about, was it totally cured? Let's just see again, but was dramatically helped. I just want to make sure it's... MS symptoms were definitely arrested in 1 person out of every 6 treated, and everyone who stuck with the histamine IV over 90 days showed improvement. And again, that's like a first step, but you definitely want to treat the parasites so you don't have the histamine problems in the future. And that is histamine IV. So it's the opposite of taking an antihistamine. So taking an antihistamine is decreasing the histamine in your body, and these doctors were all giving extra histamine. And they found it was dramatically helpful. All right, so with that, I'm going to let you guys go. Next week, I will be hosting my live masterclass training. I'm going to be talking more in depth about the steps that we take to recover from these parasites, the plan, and also a lot of case studies. You'll hear of students that are in the program right now, what they're experiencing. And then if you'd like to join us, you can join us, but at least you'll have a much greater understanding of the process that you need to do to recover. So make sure that you're connected with me. Make sure that you click on the link. We will have it in the Facebook feeds, in the posts in the Facebook, and also YouTube. And you can always visit livediseasefree.com, and you can opt in, and you will end up getting on our list, and then you'll get information about the call also. That'll be Wednesday, next Wednesday. That'll be at 5 o'clock Pacific on the 2nd of November, the 2nd of November. So we're starting to get close to the holidays here. So I really hope that this has helped you to have more clarity and confidence that MS is caused by a parasitic infestation. There's tons and tons of evidence. I've showed you pictures, I've showed you studies, and now I'm showing you all of this histamine, antihistamine, mast cell activation, and it's common in it with multiple sclerosis, but other diseases. So you want to recover, you got to treat those parasites. That is the only way to get the greatest quality of life. So I hope you have a wonderful week. Take care and bye-bye for now.